School counselors are often one of, if not the only, mental health resource for so many children. And in the wake of the pandemic, they're needed now more than ever. But getting trained, qualified, and diverse counselors in schools remains a challenge. According to the latest data from the American School Counselor Association, there was just one counselor for every 408 students during the 2021-22 school year. In Illinois, the ratio was even worse, one counselor for every 522 students. The association recommends one counselor for every 250 students. In an effort to bridge the mental health gap in schools, DePaul University recently announced a program to prepare 96 diverse school counselors through graduate work and then place them in high-need CPS elementary schools. That work is being done with the help of a $4 million grant from the Department of Education. And joining us this morning here on the stream, two people working on that project, psychology professor Antonio Polo and associate professor Melissa Ackerman with DePaul's Department of Counseling and Special Education. Good morning to you both. Professor Polo, we'll start with you. Tell us more about this program and what you hope to achieve.
Yeah, well, we know that mental health problems, including anxiety and depression, were highly prevalent among youth even before COVID, and the pandemic exacerbated these concerns. And there's really a high unmet need, and the schools are an ideal setting for fostering the emotional well-being of children and adolescents. So with this grant, we have an opportunity to help increase the number of providers of diverse backgrounds to serve students that are in high-need elementary and middle schools in CPS.
And Melissa, we outlined the lack of counselors in schools, particularly prevalent here in the state of Illinois. What's the potential impact of not having enough counselors in schools, particularly in inner city areas where there's a high need for that certainly mental health help that these kids so sorely need?
Yeah, you're exactly right, Ryan. We absolutely need school counselors who can mirror and match the cultural and linguistic characteristics of the students. As Dr. Polo mentioned, we've seen increased rates of anxiety, increased rates of depression, increased rates of suicidal ideation. So we really need to meet students and families where they are in the schools.
And Dr. Polo, you talked about the decision to train a diverse group of counselors. How important is that representation to have counselors that students can know that mirror them and they can look like them, talk like them, who they can trust?
It's incredibly important, and our efforts are going to attempt to bridge that gap. So the underrepresentation is not just prevalent here in Chicago, but nationwide. But with this federal funding, we have an opportunity to address some of that gap and provide really good supports to trainees as they're beginning their career during their internship year. So we're really excited, and the training that we're going to be providing we hope increases their cultural competence and also utilizes two partnerships that had existed already with CPS and capitalizes on them to be able to then provide state-of-the-art and evidence-based training with programs that we know work.
And this $4+ million grant is just tremendous. I'm sure you're very appreciative at DePaul to get that funding. What kind of response or interest have you seen so far for people to fill those slots to train 96 counselors that can ultimately be placed in these high-need elementary CPS schools?
Right. Well, school counseling is a really rigorous and overwhelming profession, and we are trying our best to help decrease those barriers to entry. So, for example, it's a 2-year graduate program that has a 700-hour unpaid internship. And so, you can imagine if you are in a school building from 7 a.m. to 4 p.m., it's very hard to retain a full-time job. So what we're trying to do with this grant is to provide stipends as well as tuition reimbursement as well as transportation. So we anticipate that there will be large interest in this, and hopefully people will come to DePaul where we hope to make systemic change.
That is great news. Antonio Polo and Melissa Ackerman, thanks so much for being with us this morning.
Thank you.